Welcome back. To expand care for individuals with disabilities, ICS received a $200,000 grant from the New York Health Foundation. The grant aims to enhance the development of a center of excellence in primary care for people with physical disabilities. ICS Senior Vice President of Clinical Program Population of Health, Rachael Stacom, and Outreach Associate Christy Cruz-Cullins joins me to discuss the impact this will have on the ICS community. Thank you both so much for joining me.
Thanks for having us.
Thank you
We're
for
happy to
having
be
us.
here.
Now, can you just explain, what are the main components of the ICS primary care program?
Sure. So I just want to start by saying we are ambitious. There are several components to this. The overall goal, as you said, is to develop a model of care, right? So one doesn't exist today. What is the care that people with physical disabilities need? It seems simple, but there are numerous barriers that we know that people face when they live with a physical disability. When they are doing things like trying to stay healthy, get their health screenings, and treat common illnesses. So we're working to reduce those and improve access to care. So just to give you a few of the components, so disability is rarely included as an identifier in a medical record. And so what happens is that someone in a wheelchair shows up for an appointment to see a provider, and the provider doesn't know what to do. So simple things like get up on the exam table become very challenging. And so if you're someone in a chair, so what the impact of that is that people in wheelchairs are often examined in their chair. But if you knew that someone needed accommodations and you capture those, that we can try to reduce those barriers, right? So for instance, if we're talking about the table, instead of having a fixed table, you can have a table that goes up and down so that someone in a wheelchair could slide across and then get a quality exam, right? And so that's what we're working to do, to really identify those barriers and then meet the accommodation needs of individuals. And then moving from the individuals, if someone is not identifiable in the medical record, then you really don't know what their healthcare needs are as a population. So that is also what we're trying to do, to really begin to look at access to care and see if there are some gaps in care.
And I definitely want to, take a moment and say that's so important.
Yes.
And, just you explaining that right now, these are a lot of things that unfortunately people don't necessarily think about. And so I think that is just, it's just so amazing that we do have at least, there's a program now that's kind of like addressing those problems. Christy, can you just say, how the primary care program impacted your life? Talk about your experience with that.
For me, it impacted my life in 2016 when I became pregnant with my now 8-year-old daughter. They helped me identify a location that was wheelchair accessible, as well as a provider that was knowledgeable about people with physical disabilities, specifically women.
Thank you so much for, sharing a little bit more about you and, how this has impacted you. Now, I really want to talk about the $200,000 grant, which congratulations.
Thank you.
That is
Thank
amazing.
you.
Can you talk about how this grant will kind of just help further support the community that you serve?
Yeah. So the grant is really for us to, we have gone into clinics and supported individual clinics before, but really now our hope is to learn and to capture those learnings. So we are going to work with researchers to structure the work so that we're looking at outcomes and that we're learning from it, and that we're taking then those learnings and sharing them by dissemination. So people with disabilities are not covered in schools, and so the healthcare workforce does not know how to care for them. And so it's usually, as I said, they're trying to figure it out. And it's really so to create a curriculum as well, so that they can be incorporated in schools or in the clinic, right, to help the healthcare workforce understand how to meet these needs.
And then can you expand on the Center of Excellence in Primary Care? Is that what it
Yeah, so it's
essentially is?
it's really going in and saying, where are the access to care issues, where are the health inequities, and because we can't identify them in the EMR, I'm sorry, we use acronyms a lot in healthcare, in the electronic medical record, we don't know. So this is really to start collecting that data and then to say, okay, so for instance, a woman goes for a mammography. If you're quadriplegic, you can't. If you think about a mammography, you have to lift your arms, you have to lean forward. If you don't have movement, what do? And so we've been working to address that, and then we need to capture it right? And say, okay, we've been able to improve this or not, and learn from that, right? And so that work can move forward. So this is really a beginning to start to reduce those health inequities that people with physical disabilities face.
And I just want to add that in, 2024, unfortunately, the fact that, there are still people who don't have access to quality care, especially when it comes to, anything that is dealing with primary care,
Yeah.
I think that is, very shocking. Can you just further expand on how, just the lack of access to this primary care can impact maybe other areas of their health?
Sure. Well, if we look at people with physical disability and how they're accessing the healthcare system, we know about our members, right? We collect data. And so we see that people with disabilities are often using the ER in lieu of primary care, right? I have a urinary tract infection, so I'm going to go to the ER and get it treated because I can't get in to see a provider. And so they wait, and then when they're very sick when they show up, and so then they're being admitted and will stay there for an average of like 8 days. So how do you get in front of that, right? Can you prevent the urinary tract infection, or can you identify it early so that it's treated outpatient? And so these are the things that we're trying to address through really comprehensive quality primary care.
Now, Christy, how do you hope this funding will continue to further support efforts to assist those with disabilities?
My hope is that it assists in just educating the public and bringing awareness to not only what we have to offer as an organization, right, but allow others to want to mimic what we are doing, right? Because the more folks that are doing it, the better system we have medically.
Yeah.
And can you further expand? I know that you are currently Outreach Associate. Can you just further expand on, some of the work that you do, with the community, and, how you hope, this funding and just how, we hopefully plan to move forward could impact the community as well?
What I do for the organization, I'm an Outreach Associate, and so I assist with helping enroll folks into the program that need obviously the support services that Rachael has shared with us today. And the goal is to make sure that people live better, healthier lives.
I think the other thing, I'm just going to jump in for Christy, because I think the other thing that Christy does incredibly well is speak to lived experience and to say, you deserve more. You deserve better care, and you can ask for it and you can demand it, right?
Absolutely.
And I think it's so important that I definitely have to, highlight that it's not just, there's people from the community working at ICS. We spoke to the organization many times before, and there's always people from, who have disabilities working, with ICS, and it's not just, it's not like a one-sided thing. Can you speak to the importance of, being a part of the community and working with the community as well?
I think as a recipient of the service, playing both sides of the fence, so to speak, it's a win-win because I know firsthand what the organization has done for me personally, but I also know that professionally I'm able to assist someone in getting those same support services that I've used.
And I can imagine, and you can speak to this, I'm assuming that, people who join probably feel like a little bit more comfortable if they hear, you say, oh, this organization has helped me out. Is that something that you've heard as well?
I've definitely done that. They are very delighted to see that I'm also a person with a disability, kind of, doing the stuff from the background and being able to help them. They're very happy with that.
That's amazing, and it's something that I love to hear and definitely wanted to highlight. Now, Rachael, how does ICS ensure that they continually evolve to meet the needs of people with disabilities?
So I think we try very hard to listen to what the community needs and try to address them. So there's an advocacy league that's created by people with disabilities. They meet regularly with the leadership staff to really give feedback. And it also allows us to ask questions too, to hear from the community about what their needs are. And we also, as I said, collect data, right, to see where are the health disparities and where are the gaps in care. And then to get feedback from them when we say, okay, we have a plan. Is this plan right? Is it going to work? Because, the cry from the disability community is nothing about us without us, and we try very hard to live that.
I also want to take a moment to kind of ask you a little bit more about the technology, because I understand that that is a really huge thing. Can you talk
Yes.
about, how technology is being used to evolve these services?
I mean, technology, and look at the pandemic, right? Like, we all went to technology to work, to live, and the healthcare system is no different. And so access to technology becomes vital. It's really how we are learning. And so if you look at population health, right? So we say, oh, people in the Bronx need this. It's all by using technology. And so currently people with physical disabilities are invisible. They do not exist in the healthcare system. And there's work being done to address that. Without technology, they're not going to be seen, right? And that's really what we're working to change. And so our goal is to spread, right? To learn and to spread those learnings so that it's not just our members, but people with disabilities throughout the country.
And how can people get in touch with the organization to learn more, to, eventually support or even collaborate?
Yes. So reach out to ICS. And I feel like one is, if you're a person with a disability and need a primary care, or if you're interested in participating in this pilot, reach out to ICS. It's icsny.org. You might get Christy. Together we will answer any questions you have. We look forward to hearing from people.
And Christy, who is eligible for the primary care program, and how can people learn more, or how can people know that this may be the right program for them?
Well, you obviously, a person with a physical disability, be a Medicaid recipient to participate in the program.
All right, well, I want to thank you both so much for joining me and having this discussion. I think it's so amazing. Earlier today we learned about some other programs that are available, for youth with disability. And so I think it's so important that we continue to have these discussions, because, I was really sad to hear that in 2024 there are still people who don't have access to adequate primary care. And I definitely think as a society it's up to all of us to do better, to make sure that we all have what we need. So once again, I want to thank you both so much for joining us and having this conversation.
Thank you.
Thank you so much.
To learn more about their efforts in supporting those living with a disability, please go to their website at icsny.org. Stay tuned, we have more for you right after this.